It is patients with metastatic disease, with bone metastatic disease, and radium in the form that it is given intravenously is taken up in the bone, in the metastatic lesions. So it's, you can say that it's some sort of targeted radiotherapy. It's extremely short range and a very, very high efficiency, so it is killing the tumor cells as soon as it comes to the bony metastases, the metastatic lesions. That was a global trial where more than 900 patients were randomized between either Radium-223, the active treatment, and other patients were randomized to placebo, to saline infusions. And this is given intravenously and is taken up in the metastatic lesions in the bone. It works very well. So it actually prolongs life. It has an overall survival benefit of 3.6 months, which is fairly good in this context. And the important thing is that it had a very mild side effect. And this is actually what we have also been talking about today, the very benign safety profile. In all the previous trials, the phase 1 and phase 2 trials, and also in the ASCO trial, we found that it had a very benign safety profile. So we really wanted to find out, is it also so when you follow patients for a longer time? And we didn't see very much of toxicity at all. We saw some effect on the bone marrow, of course, because that is the risk organ. But in comparison with placebo, astonishingly mild side effects. You know for sure, we know that it's a very effective treatment since it really prolongs life in comparison with placebo. This therapy has been used in this trial in patients both before chemotherapy and also in patients who have received chemotherapy. And we don't know exactly where we should place this treatment because, as you say, there are many new drugs coming up and are being used in this disease. And what we can say, this treatment is as effective as the other drugs, and the positive thing is that the side effects are so mild. The surgical procedure is used in patients with localized disease when you're aiming for a curative treatment. So you have surgery and you have radiotherapy. You could choose either one of them. But this treatment is in patients who have metastatic disease where the disease has spread from the prostate and out in the skeleton. I think it is clear from this ASCO study that the treatment is very effective, and if you have a patient with preferentially bony metastasis, then I think this patient could be a very good candidate for this treatment. But the patients with visual metastasis, with metastasis to the lung or the liver or other organs, have not been included in this trial just due to the fact that this is a bone treatment. The take-home message is that alpha-radian, or the Radium-223, is a very effective treatment. It's being used in patients with bone metastatic lesions, in castration-resistant patients, that is in patients who are failing hormonal treatment. This is effective, it prolongs life, and it has also very few side effects. So I think that is the take-home message. Together what we were talking about today, also in patients which we have been following for a longer time, they also have this very low side effects that we found in the original study.